Hi everybody, I just wanted to talk to you about a commonly asked question I'm getting these days. A lot of people are losing weight, whether it's naturally, whether they're using peptides like Ozempic, or whether they have bariatric weight loss surgery. Once you lose the weight, what's going to happen to your skin? I think one of the important things to realize is the rate at which you lose weight. If you lose a lot of weight in a short period of time, through any means, whether it's Ozempic or diet and exercise or surgery, you're going to have loose skin that needs to be dealt with. If you can lose most of your weight over a longer period of time, for example, if you lose 50 pounds over a year, your skin will probably retract and you can avoid a skin removal surgery like a tummy tuck. If you lose 50 pounds over, let's say, 2, 3, 4 months with a more drastic procedure like a gastric sleeve, you're going to have a lot more loose skin and your skin can't keep up with that pace of the weight loss. And then you'll need surgeries such as breast lifts or tummy tucks, or maybe even a body lift or arm lift or a thigh lift. So if you are losing weight or planning to lose weight, just keep in mind the rate at which you lose it. Try to lose it at a slower pace. It's healthier for your body overall and for your metabolism. And you can maybe avoid having a plastic surgery procedure. I hope that's helpful. Let us know if you have any questions or comments. Thanks.